Hello aspirants, welcome to GDC English classes. Welcome to TEJAS series. So this series helpful for the who are preparing for pharmacist, especially RRB as well as Telangana and all related pharma government jobs, especially pharmacist exam. So in this session, we will discuss regarding the pharmacology of antidepressants as well as antipsychotics, especially MCQs along with the detailed explanation. So let's go into the session. I hope you already started your preparation and the preparation is going on swing, nothing but it is going on very well note. Regarding RRB, I think most probably the exam is on December or January. But regarding regarding Telangana pharmacist, already the notification released. Nearly more than 600 plus vacancies are there. Definitely like this MCQ series explanation and GDC classes, especially GDC English classes, help you to reach your goal. So follow our channel. You can contact me on given number also for more details. Okay, thank you. So going to the detailed of our session, the MCQs discussion on the given antidepressants as well as antipsychotics. Okay, antidepressants as well as antipsychotics. The first MCQ is which of the following is an antipsychotic drug? So antipsychotics also known as drugs for treatment of schizophrenia. Schizophrenia means schizo means splitted, phren means brain, splitted brain. So different personalities. So antipsychotics also known as anti-schizophrenic drugs, nothing but drugs for treatment of schizophrenia. And antipsychotics also known as major tranquilizer. So tranquilizer nothing but the agent or substance used to calm down the person. The options like flupentixol, rasazilin, clobazam, divalproex. So divalproex is a prodrug form of valproic acid. Clobazam is a benzodiazepine category of drug. Rasazilin is a MAO-B inhibitor for treatment of Parkinsonism. Definitely the answer will be the flupentixol. Flupentixol is the answer. So regarding the classification of antipsychotics based on their chemical nature, first phenothiazines. Phenothiazines with aliphatic side chain. Pheno, diphenylthiazine. So two benzyl groups are there and in between there is a 6 cyclic ring containing sulfur nitrogen in the opposite direction. So the examples of drug with aliphatic side chain, chlorpromazine, triflupromazine. Chlorpromazine is a first successful antipsychotic and also for treatment of hiccups. Next, phenothiazines with piperidine side chain thioredoxin. Piperidine, thioredoxin. Next, piperazine. Piperazine, trifluperazine, fluphenazine. Fluphenazine, trifluperazine, and thioredoxin. Next, butyrofenones like haloperidol, trifluperidol, penfluridol. Next, thioxanthine, especially flupentixol, thioxanthine, flupentixol, and other heterocyclic structures containing drugs like pimozide, loxapine, levosulfide, and atypical neuroleptics. So, antipsychotics also known as neuroleptics, antipsychotics also known as major tranquilizers, and other category especially atypical. So this atypical category of drugs differ from this typical category are classical antipsychotics because atypical drugs can block serotonin as well as dopamine receptors. When coming to the classical or typical drugs, they only block dopamine receptors. So drugs like clozapine, risperidone, olanzapine, quetiapine, and aripiprazole, a partial drug, ziprasidone, amisulpiride, zotapine. So this is a classification of antipsychotics based on their chemistry. Next, the next MCQ is haloperidol. Haloperidol is a major tranquilizer belong to the class of phenothiazine, xanthine, Butyrophenone carbamates. So carbamates nothing but carbamic acid. So phenothiazine generally chlorpromazine, xanthine, thioxanthin, flupenthixol. Butyrophenone belongs to the haloperidol, droperidol. The answer is haloperidol belongs to chemical class of butyrophenones. Butyrophenones. So already we gone through the same classification in the previous slide. So butyrophenones example like haloperidol, trifluperidol, penfluridol as well as droperidol. And these butyrophenones are high potent drugs. Shows excellent action at low doses also. Low doses also. Next, so the interesting question is drug which do not have any antiemetic as well as extrapyramidal actions. So extrapyramidal symptoms, Parkinsonism, especially antipsychotics produces extrapyramidal symptoms like Parkinsonism disorder by blocking dopamine receptors in the substantia nigra. So, damage of dopamine receptors in the substantia nigra or nigrostriatal pathway develops Parkinsonism symptoms. So, which of the following category of drug, example of drug does not having antiemetic action and also extrapyramidal action, no Parkinsonism as a side effect and no antiemetic action because dopamine is also one of the neurotransmitter involves in the emesis, vomiting production. But antipsychotics are the drugs, they block dopamine receptors in the brain. So blocking of dopamine receptors related to vomiting and decrease vomiting. So antipsychotics also having antiemetic action. But here which of the following antipsychotic not having antiemetic as well as not having Parkinsonism as a side effect. So clozapine is the second generation or atypical antipsychotic, trifluperidol, triflupromazine, risperidone. All these are first generation antipsychotics. All first generation are typical or classical antipsychotics. They produce extrapyramidal symptoms, Parkinsonism as a side effect. But the second generation drugs like clozapine does not having extrapyramidal symptoms. So extrapyramidal symptoms example is Parkinsonism. Yes, the answer is the clozapine. Here, clozapine having very low chance, no chance of extrapyramidal symptoms, and sedation is also less. Hypotensive, control the BP also less. And coming to the triflupromazine, trifluridol, risperidone, all these are first generation or classical or typical antipsychotics high having high chance of Parkinsonism as a side effect, extrapyramidal symptoms. Okay. Next, atypical antidepressants is, so in the depressants also antidepressants. Antidepressants are the drugs used for treatment of depression. The depression is because of decreased catecholamine levels in the central nervous system. So drugs like imipramine, amoxapine, bupropion, citalopram. So citalopram, amoxapine, imipramine are comes under the category of typical antidepressants. But bupropion is comes under atypical antidepressant. So let's see the discussion. You will understand more regarding this MCQ. Atypical antidepressants. So atypical antidepressants including bupropion, meancerin, mirtazapine, amoxapine, maprotilene, trazodone, nafazodone. Atypical antidepressants acts by enhancing the monoamines like dopamine, noradrenaline, serotonin as well as adrenaline in the brain by inhibiting their reuptake of preventing their degradation. So especially in the depression there is a decreasing monoamine levels in the brain and antidepressant increase the monoamine levels in the brain. They increase the monoamine levels by increasing their duration at postsynapse. Generally, if any neurotransmitter released from the presynapse, it bind to the receptors on the postsynapse. Bind to the receptors on the postsynapse. By binding to the receptor shows the action. Once after completion of action, from postsynapse to they have to go for presynapse. But in the depression, we need more amount of neurotransmitter. That's why we have to inhibit reuptake of this neurotransmitter from post-synapse to pre-synapse. If reuptake was inhibited, then more time the neurotransmitter is spent at receptor. Next, imipramine. What imipramine will do? Inhibition of noradrenaline and serotonin uptake associate with the antidepressant action belongs to the tricyclic antidepressants. Imipramine is a non-selective. It can inhibit the reuptake of serotonin, noradrenaline, and it is a antidepressant and it belongs to chemically tricyclic antidepressant. Next, 𝘎𝙁𝙎. 𝘎𝙁𝙎 predominantly TCA class drug. It may also cause inhibition of presynaptic reuptake of norepinephrine. 𝘎𝙁𝙎. Citalopram. The S isomer of citalopram is S-citalopram. ES. Capital ES. Citalopram is a class of antidepressant called SSRI. It is selectively inhibit the reuptake of serotonin. Selective serotonin reuptake inhibitor. Next, antidepressant, which is a presynaptic alpha 2 receptor blocker, which enhance secretion of both norepinephrine as well as serotonin. So examples like trazodone, mirtazapine, 𝘕𝙎𝑎𝑛𝑠𝑒rin, bupropion. All these are atypical antidepressants. Generally, typical antidepressants acts by inhibit the reuptake of neurotransmitter from postsynapse to presynapse and increase the levels of neurotransmitters at postsynapse. But atypical antidepressants acts by inhibiting the reuptake of by blocking autoreceptors like alpha 2 receptor. Autoreceptors also known as presynaptic receptors. Example, alpha 2 receptor. When autoreceptors are activated, they inhibit the release of neurotransmitter. But when alpha 2 receptors are blocked, antagonized, they increase the release of neurotransmitter. So here, antidepressant, which is a presynaptic alpha 2 receptor blocker, which enhances secretion of norepinephrine and serotonin. Agonism of alpha 2 receptor decrease the release of neurotransmitter. Blocking or antagonism of alpha 2 receptor, nothing but autoreceptor, increase the release of neurotransmitter. So here examples like trazodone, mirtazapine, 𝘕𝙎𝑎𝑛𝑠𝑒rin, bupropion, all are atypical antidepressants, and here the answer is mirtazapine. Mirtazapine block presynaptic alpha 2 receptor, enhance norepinephrine serotonin. Mirta serotonin. So here this antidepressant act by novel mechanism, that is blocks alpha 2 receptor and enhance the release of noradrenaline as well as serotonin and increase the both releases. So acts on the alpha 2 autoreceptors and heteroreceptors of serotonin and increase the release of both serotonin and noradrenaline, helps in the treatment of depression. So all are side effects of clozapine except. So clozapine is the second generation antipsychotic. Clozapine is the second generation antipsychotic. It is also known as atypical antipsychotic. So second generation antipsychotics commonly produces atypical extrapyramidal symptoms. Parkinsonism has a side effect. So clozapine having side effect like granulocytopenia, reduction in granulocytes. Clozapine may develop seizures. Clozapine may produce sedation. But clozapine is a second generation or atypical antipsychotic, does not involve in the extrapyramidal symptoms. Extrapyramidal symptoms example is Parkinsonism. Parkinsonism is a neurodegenerative disorder in which decreased dopamine and increased acetylcholine in the substantia nigra, a nigrostriatal pathway. So dopamine in the nigrostriatal pathway, nothing but substantia nigra, responsible for our body movements. But Parkinsonism is a loss of body movements, decreased body movements. So the dopamine in the nigrostriatal pathway regulates body movements. But our antipsychotics, especially first generation antipsychotics, they block dopamine in the nigrostriatal pathway. So decreasing dopamine in the nigrostriatal pathway decrease body movements. That's why Parkinsonism is a movement disorder, decreased body movements. But second generation antipsychotics like clozapine does not cause extrapyramidal symptoms. Yes, the answer is extrapyramidal symptoms. So clozapine is a very important drug having high application in the clinical field of psychosis, treatment of psychosis, nothing but schizophrenia. Clozapine is the first atypical antipsychotic pharmacologically distinct, different from the chlorpromazine. It has only weak dopamine type 2 receptor blocking, produce few or no extrapyramidal symptoms, that is Parkinsonism. Tardive dyskinesia is rare. Tardive dyskinesia is rare. So both Parkinsonism and tardive dyskinesia are extrapyramidal symptoms. So Parkinsonism nothing but it is a neurodegenerative disorder affect our body movements, and tardive dyskinesia is also involuntary body movements, especially our tongue, our limbs as well as our skeletal muscle also. High dose can induce seizures even in non-epileptics, and other side effects like sedation, unstable blood pressure, tachycardia, urinary incontinence, and its major limitation is high incidence of agranulocytosis, decrease the blood cells, especially WBC count, and its derivative olanzapine, olanzapine does not having agranulocytosis. Next question. So which of the following extrapyramidal effects seen with the antipsychotic agents also known as rabbit syndrome? Which of the following extrapyramidal effect seen with antipsychotic agents also known as rabbit syndrome? Acute dystonia reaction, Parkinsonism syndrome, tardive dyskinesia, perioral tremor. Okay, so the answer will be the perioral tremors. So acute dystonia abnormality in the tone, Parkinsonism a extrapyramidal symptom, tardive dyskinesia a extrapyramidal symptom, the involuntary movements of our body parts, especially like tongue as well as limbs and other body parts, and the answer is perioral tremor. And regarding the explanation here, perioral tremors, also known as rabbit syndrome, may occur after several months of antipsychotic therapy. Rabbit syndrome is an antipsychotic induced rhythmic motion of the mouth or lips resembling the chewing movements of rabbit. The movement consists of a vertical only motion about 5 heads with no involvement of tongue, and anticholinergics also useful in the treatment of this rabbit syndrome, nothing but perioral tremors. Next, the drug of choice for treatment of negative symptoms of schizophrenia. The drug of choice for treatment of negative symptoms of schizophrenia, nothing but psychosis. So psychosis is nothing but it is an vigorous, uncontrolled thoughts as well as behavior of a person, especially because of over domination of excitatory neurotransmission with high involvement of dopamine, glutamate also. So dopamine plays major role. That's why antipsychotics are known as dopamine antagonists. By blocking dopamine action, they decrease the psychotic behavior in the person. So here negative symptoms in the schizophrenia or psychosis, the person with the psychosis, there are two types of symptoms. Positive symptoms, especially excess dopamine levels in the mesolimbic system. So the positive symptoms are because of excess dopamine levels in the mesolimbic system. Mesolimbic means the part between midbrain and limbic system. Limbic system responsible for our behavior, emotion, motivation. If the dopamine excess in the mesolimbic dopamine pathway, it may cause irregularity of our behavior, emotions as well as our motivations. And negative symptoms are because of decreasing dopamine levels in the mesocortical pathway. So cortex is majorly responsible for our sensory activities. So the drug of choice for treatment of negative symptoms of schizophrenia. So especially second generation antipsychotics. Second generation antipsychotics are mainly for treatment of negative symptoms of schizophrenia. So chlorpromazine first generation, haloperidol first generation, doxepin also comes under first generation. Clozapine is a second generation or atypical antipsychotic. So it is for treatment of negative symptoms of schizophrenia. So negative symptoms of schizophrenia are because of decrease in dopamine levels. Decrease in dopamine levels in the decrease in dopamine levels in the mesocortex pathway. Cortex is responsible for our sensory activities. If dopamine is decreased in the cortex, our sensory activities will be decreased. So let's see here the discussion for more clarity. Patient with negative symptoms. Patient with negative symptoms and resistant case of schizophrenia. Clozapine is a drug of choice. Clozapine is drug of resistant. So some drugs are not showing action. So some cases of psychosis not responding become resistant. In that resistant cases and in the treatment of negative symptoms of psychosis, clozapine is the preferred. And along with clozapine, some alternative drugs. If clozapine is not there, 𝘿𝙄𝙎𝘾𝙄𝙎, derivative of clozapine, does not having agranulocytosis, does not involves in the reduction of granulocytes. And also risperidone, aripiprazole, ziprasidone, aripiprazole, risperidone, olanzapine. And here these are the symptoms of positive symptoms of schizophrenia: delusions, false perceptions, false beliefs, not perception, false beliefs, hallucination, disorganized speech. So disorganized speech, disorganized thoughts, hallucinations, delusions. These are the positive symptoms because of increasing dopamine levels in the mesolimbic pathway. And negative symptoms are because of wait a minute. Negative symptoms are because of decrease in dopamine in the mesocortical pathway. So especially effects like flattening effect, reduced speech, alogia, alogia, reduced speech, lack of initiation, lack of motivation, and flattened emotional numbness. No response like no angriness, no sadness, no happiness, the facial numbness, no expressions in the face. So all these sensory activities are lost due to decreased dopamine, in the mesocortical pathway, and positive symptoms because of excess dopamine in the mesolimbic pathway. Which of the following antidepressant associate with cardiovascular risk? Which of the following antidepressant associate with cardiovascular risk? Option: citalopram, bupropion, imipramine, sertraline, citalopram, bupropion, imipramine, sertraline. All are antidepressant useful in the treatment of depression. Yes, the answer is citalopram. Citalopram is antidepressant. So see the explanation here. Citalopram. Wait a minute. So regarding the discussion, citalopram having half-life around 33 hours, no active metabolite is known. However, prolongation of QT interval, it involves in the prolongation of QT interval, and a few deaths due to overdose of citalopram are on record, because of which it is to be avoided in the patient like to attempt suicide. Citalopram preferred SSRI for mood disorders in premenstrual dysphoric disorder. Premenstrual dysphoria. Euphoria means excitable state, feeling of well-being, state of well-being. Dysphoria means opposite, a feeling of sadness, depression. So it is preferred SSRI for mood disorders, especially premenstrual dysphoric. So menstrual disorders. Menstrual disorders also psychologically disturb and may cause mood disorders. That mood disorders The preferred drug is citalopram, but citalopram having cardiovascular risk may cause tachycardia, excess heartbeat. Next, which of the following atypical antipsychotic would be the least sedation? So the least sedation property with which of the following drug? So which of the following atypical antipsychotic would be the least sedating? Quetiapine, risperidone, olanzapine, clozapine. Clozapine, olanzapine both are derivatives. Olanzapine having agranulocytosis, decrease granulocytes, and clozapine decrease granulocytes. Olanzapine does not. Okay, the answer is the least sedation property with risperidone. Risperidone. So all are atypical antidepressant, but least sedation property with risperidone. Risperidone is one of the most common used atypical antipsychotics. Adverse effects like nausea, anorexia, agitation, drowsiness. Most common used atypical antipsychotic. Adverse effects including nausea, anorexia, agitation, drowsiness. Next, extrapyramidal symptoms, tardive dyskinesia, increased prolactin levels occur at low chance. It has no or least sedation, no or least sedation property. So increasing prolactin levels. So the first generation antipsychotics, especially the first generation antipsychotics having drawback of extrapyramidal symptoms as well as hyperprolactinemia. Hyperprolactinemia, especially dopamine. There is a tuberoinfundibular pathway. Tuberoinfundibular pathway. The pathway of CNS regulates dopamine. So presence of dopamine in this pathway control prolactin, decrease the prolactin. So presence of dopamine decrease the prolactin. But our antipsychotics blocking dopamine action, so decreasing dopamine levels in the tuberoinfundibular dopamine pathway. Decreasing dopamine levels in the tuberoinfundibular dopamine pathway causes hyperprolactinemia, because decreasing dopamine increase the prolactin, that is hyperprolactinemia, increase prolactin levels. Next, cardiac conduction defect seen with the tricyclic antidepressants. Cardiac conduction defect, a defect in the heart conduction velocity of heart is because of tricyclic antidepressants. Seen with the tricyclic antidepressants due to, so cardiac conduction defect seen with tricyclic antidepressant due to norepinephrine and serotonin uptake inhibitor, anti-muscarinic action on heart, only norepinephrine uptake inhibition, both norepinephrine uptake inhibition as well as anti-muscarinic action on heart. So decreasing heart conduction. So decreasing heart conduction because of excess parasympathetic activity. So parasympathetic nervous system releases acetylcholine. Acetylcholine on heart decrease heart rate. So here answer will be the inhibition of norepinephrine uptake and also anti-muscarinic action on heart, that is affect the cardiac conduction. Both norepinephrine uptake inhibition as well as anti-muscarinic action on heart. Anti-muscarinic atropine may increase the heart rate. So let's see the discussion for more clarity. Wait a minute. So action of tricyclic antidepressants on cardiovascular system. Change in the ECG as well as may leads to cardiac arrhythmias, abnormality in the rhythm of heart. T wave suppression or inversion is a most consistent change in the ECG. So suppressing, so decreasing T wave or inversion of T wave, reverse. Arrhythmias occur in overdose mainly because of interfere with intraventricular conduction. So the noradrenaline potentiating plus cholinergic blocking action along with the direct myocardial depression compound the pro-arrhythmic potential. So there is a chance of arrhythmias, abnormal rhythms in the heartbeat, So especially because of both norepinephrine uptake inhibition as well as antimuscarinic action on heart. Drug of choice for akathisia. So what is the drug of choice for akathisia? So drug of choice for further continuation, the drug of choice for akathisia is central anticholinergics propranolol, levodopa, dandrolene. So here generally akathisia is the meaning of akathisia is feeling of restlessness. So central anticholinergics block muscarinic receptors. Propranolol is a sympatholytic beta receptor blocker. Levodopa a drug of choice for Parkinsonism, and dantrolene a drug of choice for malignant hyperthermia. So the answer is propranolol a sympatholytic block beta receptors. So let's see the discussion. Acute muscular dystonia, a abnormality in the tone, that is continuous spasm and muscle contraction, abnormal muscle contraction. The treatment benzyhexol is a drug of choice. Benzyhexol is a anti-muscarinic drug. Next, akathisia. It manifests as motor restlessness. Drug of choice propranolol and benzyhexol also useful. Next, Parkinsonism. The characteristic symptoms like muscle rigidity, no free movement of muscles. Drug of choice benzyhexol. Next, tardive dyskinesia, irregular jerky movements of body like tongue, like limbs, and remaining body movements. So drug of choice like valbenazine is approved. Benzyhexol is contraindicated, not useful. Next, malignant neuroleptic syndrome can be life-threatening neuroleptic syndrome. Dantrolene is used to relax muscle spasms. Benzyhexol and bromocriptine also useful. Benzyhexol as well as bromocriptine also useful. So these are the list of the condition along with their meanings as well as drug of choice. So going forward for the next question, SSRI are drug of choice for all of the following condition except SSRI. Selective serotonin reuptake inhibitors are drug of choice for all of the following condition except panic attacks, sudden panic attacks, seeing snakes, social phobia, not interacting with people, post traumatic stress disorder, generalized anxiety disorder GAD, the general anxiety disorder, panic attacks, social phobia, post traumatic stress disorder. So post traumatic means they're recollecting their previous experience, like soldiers in this previous years they may lose their legs, they may lose their hands. If they're recollecting, they become stress, feeling panic. So the answer is SSRI are not drug of choice for generalized anxiety disorder. So generalized anxiety disorder is a common disorder. Everybody having anxiety disorder. Anxiety is simply worriness. So in the panic attacks, in the social phobias, in the post-traumatic stress disorders, these are useful. Next, SSRI are now the first choice of drugs for treatment of depression as well as bulimia nervosa, excess eating, bulimia nervosa, obsessive compulsive disorder OCD, post traumatic stress disorder, premenstrual tension syndrome, panic disorders, eating disorder, and social interaction. Fluoxamine is a short-acting SSRI which has been specifically recommended for generalized anxiety disorder and also OCD, but is not the drug of choice. Next, moclobemide is a moclobemide is a moclobemide is a SSRI antipsychotic drug, MAO inhibitor, prevent recycling of adrenaline. It is a MAO inhibitor, inhibit the MAO monoamino oxidase enzyme. Moclobemide. It is a Let's see the discussion regarding moclobemide. It is a reversible competitive selective monoamino oxidase A inhibitor. Moclobemide is a reversible competitive selective monoamino oxidase enzyme A inhibitor, and it is a short acting and MAO activity recovers within 1 to 2 days after stopping of drug. Once drug administration stops, the enzyme recovery from this inhibition by moclobemide. Moclobemide is a reversible competitive selective MAO A inhibitor. Salicylin, resazolin or MAO B inhibitor selective for treatment of Parkinsonism. Next, further continuation. Tricyclic antidepressant. An antidepressant drug class act on which of the following? TCA, tricyclic antidepressants are class of antidepressants, acts on GABA receptor, benzodiazepine receptor, type 2 dopamine receptor, serotonin and noradrenaline transporter. So what is a depression? Depression simply sad mode due to decrease in catecholamine levels. Decrease in catecholamine levels in the brain. Decrease in catecholamine levels in the brain. So especially decreased serotonin noradrenaline. Serotonin and noradrenaline transporter. Serotonin and noradrenaline transporter. Okay, so the transporter serotonin noradrenaline transporters are involved in reuptake of both from postsynapse to presynapse, but in the treatment of depression as an antidepressant they have to maintain more amount of neurotransmitter at the postsynapse. So these drugs inhibit the serotonin and noradrenaline transporters. So TCA block reuptake of both noradrenaline and serotonin into presynaptic terminals by binding to transporters, especially inhibit serotonin transporter and norepinephrine transporter, and inhibit the reuptake from postsynapse to presynapse. The synaptic levels of these monoamines increase, thereby prolong their action on the receptors. The tricyclic antidepressants potentiates amine neurotransmission in the central nervous system. Amine means noradrenaline, serotonin, amine, as well as dopamine also. So as you know already, these are our details of railway pharmacist, like 200 plus live classes, 500 recorded video lectures and online test series, 100 plus previous year MCQs, e-notes, and all with this fees. And if you want hard copies also available for all types of pharmacist exams throughout India. And definitely with this course you can qualify and you can get your goal to reach your goal easily. I hope do you know already the GDC English classes started classes for pharmacists like RRB as well as Telangana in English language. For more details you can contact me on 799-531-8103 regarding classes as well as materials. So the next MCQ will be dry mouth during antidepressant therapy due to blockade of dry mouth. Dry mouth generally because of decreasing salivary secretions. So decreasing salivary secretions because of decreased parasympathetic acetylcholine action, blocking of muscarinic receptors. So maybe due to blocking of muscarinic receptor, serotonergic receptor, dopamine receptor, GABA receptors. So acetylcholine stimulate the salivary glands, increase salivary secretions. So blocking of acetylcholine action on the salivary glands decrease salivary secretions. The answer will be the blocking of muscarinic acetylcholine receptors. Okay. So here TCA antidepressant therapy have anticholinergic properties, may cause dry mouth, may leads to blurred vision, constipation, retention of urine. So urine promotion by acetylcholine, increased gastric movements by acetylcholine, the normal vision by acetylcholine, increased salivary secretion by acetylcholine. But anticholinergic action causes decreased salivary secretion, dry mouth, and blurred vision due to mydriasis, constipation due to decreased acetylcholine action, and urinary retention due to decreased acetylcholine action. Decreased acetylcholine action. And even you can observe here clearly there are different side effects of this antidepressants. For example, blocking of H1 receptors produce sedation, confusion. and blocking of alpha 1 receptor, postural hypotension, decreasing BP, tachycardia, reflex tachycardia, and cardiac arrhythmias. And muscarinic receptor blocker may lead to dryness of mouth, blurred vision, constipation, etc. Next, mechanism of action of tianeptine in the brain is mechanism of action of tianeptine in the brain. Selective serotonin reuptake inhibition, selective norepinephrine reuptake inhibition, selective serotonin reuptake enhancer, selective dopamine reuptake inhibition. So tianeptine, the answer is selective serotonin reuptake enhancer. Increase the reuptake, selective serotonin reuptake enhancer. So let's see the discussion here. Tianeptine, the antidepressant, is reported to increase rather than inhibit serotonin reuptake, and it is neither sedative nor stimulant. It has shown efficacy in the anoxidative possessive, in anxiodepressive states. So it have shown excellent action in the anxiodepressive states, the depression with anxiety. Very nice. So tianeptine, it is not a selective serotonin reuptake inhibitor, and it increase the inhibition of serotonin reuptake. It increase the, sorry for my confusion. So it is a selective serotonin reuptake enhancer. Generally the drug antidepressant should do selective serotonin reuptake inhibition, but rather than that, tianeptine is a selective serotonin reuptake enhancer, enhance the reuptake of serotonin, and it is mainly for treatment of anxiodepression illness, depression related to anxiety. Very nice. Drug effective in treatment of tardive dyskinesia. Tardive dyskinesia is a type of movement disorder. Tardive dyskinesia is a type of movement disorder, that is extrapyramidal symptom. So the drug effective in tardive dyskinesia is central anticholinergic, dantrolene, succinylcholine, valbenazine. Valbenazine. The answer is valbenazine. So let's see the discussion for more clarity. So it is an tardive dyskinesia is an uncommon side effect of certain medicines causing loss of control over facial movements. By using of some drugs, we lost the control over facial movements. So loss of facial movements is simply tardive dyskinesia. Tardive dyskinesia. A extrapyramidal symptoms can be because of first generation antipsychotics. Recently, 2-vesicular monoamine transporter 2. Recently, 2-vesicular monoamino transporter 2 inhibitor deutetrabenazine, deutetrabenazine, valbenazine, approved by the United States FDA for symptomatic treatment of tardive dyskinesia. They act by depleting presynaptic stores of dopamine. They act by depleting presynaptic stores of dopamine. They decrease the stores of dopamine and control tardive dyskinesia, a uncommon side effect of drugs causing loss of control over facial movements. Next, block of which type of monoamine oxidase? Block of which type of monoamine oxidase might be more selective for depression? Block of which type of monoamine oxidase might be more selective for depression? So monoamino oxidase A, monoamino oxidase B, both MAO A and MAO B and MAO C. So generally MAO B is for treatment of Parkinsonism. Inhibition of MAO B by salicylic resacillin. So MAO B is for the Parkinsonism, MAO A is for the depression. So let's see the discussion here. The selective MAO-A inhibitors possess antidepressant activities like moclobamide, and MAO enzyme is a mitochondrial enzyme involved in oxidative deamination of biogenic amines like adenylin, noradrenaline, dopamine, serotonin. So monoamino oxidase name itself indicating inhibit the involves in the degradation of monoamines like adenylin, noradrenaline, serotonin. Two isoenzymes of MAO are there and dopamine degraded equally by both isoenzymes. MAO-A preferentially involves in the deamination, inactivation of serotonin noradrenaline, and MAO-A inhibited by chlorxylin meclobamide. Meclobamide chlorxylin inhibits the MAO-A enzyme. MAO-B preferentially deaminates phenylethylamine, phenylethylamine, and MAO-B inhibited by salicylin as well as rasazyllin, and inhibition of MAO-B helps in treatment of Parkinsonism. Next, indicate antidepressant drug that blocks reuptake pump for serotonin as well as norepinephrine. Indicate antidepressant drug block reuptake pump for serotonin norepinephrine. So options like amitriptyline, fluoxetine, maprotilene, phenylzyme. Phenylzyme. Amitriptyline is a non-selective tricyclic antidepressant. Fluoxetine is a selective serotonin reuptake inhibitor. Maprotilene, phenylzyme. The answer will be the amitriptyline. Amitriptyline is a tricyclic antidepressant. Non-selectively inhibit the reuptake of serotonin norepinephrine from postsynapse to presynapse. So see the discussion here. Amitriptyline increase the noradrenaline or serotonin transmission by blocking norepinephrine or serotonin transporter and inhibit the transport of this neurotransmitter from postsynapse to presynapse and increase the levels of neurotransmitter at postsynapse, control depression, decrease the symptoms in depression. Fluoxetine, a selective serotonin reuptake inhibitor, block the reuptake of serotonin from postsynapse to presynapse. Next, maprotilene. Maprotilene acts by potentiation of central adrenergic synapse by blocking reuptake of norepinephrine at nerve endings. Maprotilene acts by potentiation of central adrenergic synapse by blocking reuptake of norepinephrine. Phenylzyme inhibitor and substrate of monoamine oxidase cause elevation in brain levels of catecholamines and serotonin. Phenylzyme, a inhibitor of monoamino oxidase enzyme. Which of the following drug used in intractable hiccups? Which of the following drug used in intractable hiccups? Drugs like chlorpromazine, amisulpiride, venlafaxine, as well as loxapine. The answer is the chlorpromazine. Chlorpromazine is the first successful antipsychotic and it is also drug of choice for treatment of hiccups. So let's see the discussion. Intractable hiccups. The hiccups that last for more than a month. It is recorded as 1 in 10,000 people. Very rare. And drugs for intractable hiccup. Baclofen used to relax the muscles. Chlorpromazine, a medicine used to treat psychiatric illness. Haloperidol, a type of tranquilizer, calm down the person. Metoclopramide to treat problems in esophagus and GERD, gastroesophageal reflux disease. Metoclopramide. Anticonvulsant drugs like phenytoin, valproic acid, gabapentin, carbamazepine, and also sedatives. But generally, the first drug we have to recollect for treatment of intractable hiccup, chlorpromazine, and nowadays metoclopramide like to treat problems in esophagus as well as oppose the GERD, gastroesophageal reflux disease. Next, treatment of choice in refractory schizophrenia. Treatment of choice in refractory schizophrenia. So options like haloperidol, flupentixol, trifluperazine, clozapine. The answer is clozapine for refractory schizophrenia. So refractory nothing matter. So some drugs fail to treat this schizophrenia. Patient considered to be refractory is he or she failed to respond to two trials of 4 to 6 weeks of duration of monotherapy with two different drugs, that is antipsychotics. And clozapine is the only drug with proven efficacy in schizophrenia that does not respond to other antipsychotics. The treatment refractory schizophrenia, the treatment resistant schizophrenia. So the schizophrenia cases which are not respond to other drugs can treat by clozapine. Clozapine is a good drug for treatment of schizophrenia. Next, risperidone acts on which receptor? Type 2 dopamine receptor, serotonin type 2 receptor, both A and B receptor, and noradrenaline. Risperidone acts on which receptor? So risperidone is also a class of antipsychotics. It can act on both type 2 dopamine receptors as well as type 2 serotonin receptor, because risperidone is a atypical antipsychotic. So atypical antipsychotics can block serotonin type 2 receptors as well as type 2 dopamine receptors. Like the latter, it especially ameliorates negative symptoms of schizophrenia, amelioration, reduction, but produce extrapyramidal side effects. What are extrapyramidal side effects? Like Parkinsonism, tardive dyskinesia. Next, which of the following has least potential to cause metabolic syndrome except? Which of the following has least potential to cause metabolic syndrome? Option like aripiprazole, asinapine, quetiapine, ziprasidone. So quetiapine. So all pines. So all dones like ziprasidone, molindone, quetiapine, asinapine, all pine as well as dones are second generation antipsychotics are atypical antipsychotics. They may cause metabolic syndrome like diabetes or lipid disorders. So let's see the discussion. Atypical antipsychotics implicated in causing adverse metabolic effects like weight gain, hyperlipidemia, as well as insulin resistance. So especially second generation antipsychotics are atypical antipsychotics implicated in causing adverse metabolic effects like weight gain. They may produce weight gain. They may cause hyperlipidemia, excess lipids in the plasma, and insulin resistance. Insulin resistance. So insulin resistance. So insulin is there in the body, but glucose not responding. According to their potential to they cause like high potential clozapine, olanzapine, intermediate potential quetiapine, low potential risperidone, paliperidone, least potential 𝘿𝙬𝙎, aripiprazole, asinapine, ziprasidone. Next, paroxetine belongs to which class of compound? Paroxetine, MAO inhibitor, serotonin reuptake inhibitor, norepinephrine reuptake inhibitor, none of the above. So not a MAO inhibitor, not a serotonin reuptake inhibitor. Definitely answer will be the norepinephrine. Sorry, paroxetine, duloxetine. Yes, paroxetine is a serotonin reuptake inhibitor. So this is a detailed classification of antidepressants. The selective serotonin reuptake inhibitors like fluoxetine, fluoxamine, paroxetine, sertraline, citalopram, escitalopram, depoxetine. So depoxetine, paroxetine, fluoxetine are selective serotonin reuptake inhibitors. And this is a detailed classification of antidepressants. So you can go through by passing the video. Next, these are the important books. These are the important books for pharmacist exam, like theory fingertips as well as theory MCQs objective. So definitely these books helps to reach your goal. Next, chlorpromazine is an antipsychotic drug possess. So these are the books. So these are the books you can see, and already I gave my contact number also here. You can go through here, and you know the strength as well as quality of GDC. GDC is providing coaching classes for GPAT, NIPER, drug inspector as well as pharmacist in the English language. Especially English classes are mainly made for the South India people. So this is my contact number 7995318103. So I am the coordinator of GDC English classes South region. So we are at the 26th question, I think so. Yes. Chlorpromazine is an antipsychotic drug possessed chemically phenothiazine. So chemically butyrophenone, haloperidol, droperidol, thioxanthin, thiothixin, phenothiazine, chlorpromazine, ecridin, tacrin derivative. Ecridin is a ecridin example tacrin. Tacrin for treatment of Alzheimer's disease. Yes, phenothiazine is a simple. So this classification you already saw in the mostly first slides, I think. Which of the following contain a piperidine? Trifluperidol, thioridazine, levosulfuride, giprasidine. So thioridazine, piperidine, thioridazine, piperidine. The same classification we gone through many times in this video, and you can pause and you can see in detail. Which among the following is a tricyclic antidepressant? Which among the following is a tricyclic antidepressant? Amitriptyline, trazodone, phenelzine, fluoxetine. Yes, amitriptyline. Fluoxetine, selective serotonin reuptake inhibitor. Phenelzine, MAO inhibitor. Trazodone, atypical antidepressant. And amitriptyline comes under tricyclic antidepressants. Yes, this is a classification. So especially you see the amitriptyline, imipramine, trimipramine, doxepin, dothepin, clomipramine. Okay. Which of the following is shortest acting SSRI? Which of the following is shortest acting selective serotonin reuptake inhibitor? Like fluoxamine, fluoxetine, sertraline, paroxetine. Paroxetine. Which of the following is short acting SSRI? The short acting SSRI is fluoxamine. So fluoxamine is a short-acting selective serotonin reuptake inhibitor, has been specifically recommended for generalized anxiety disorder and OCD. It is potently inhibit the reuptake of serotonin but has little effect on dopamine and norepinephrine uptake system. MAO-B inhibitor should not use with the inhibitors of monoamino oxidase enzyme should not use with buprenorphine, pethidine, pentazocine, morphine. So morphine, a opioid analgesic from natural plant source. Pentazocine is also opioid analog, and pethidine also opioid analog. And the answer is pethidine. Why? Pethidine must never be used in the presence of monoamino oxidase inhibitors because of risk of fatal excitatory interaction. It also causes severe hyperpyrexia, restlessness as well as hypotension. So it also causes severe hyperpyrexia, increased body temperature, restlessness, feeling of tightness, and hypotension, reduction in BP. Pethidine never be used in presence of monoamino oxidase inhibitors because of risk of fatal excitatory. So excitatory means increased excitatory neurotransmission like aspartate, glutamate, including serotonin as well as dopamine. Over excitation. Over excitation. So this is today our session on the TEJAS series of explanation of MCQs in detail. So you know the quality of GDC regarding its classes as well as its strength. So subscribe to GDC English classes. So RRB classes already going on, including Telangana also. So Telangana releases 600 plus pharmacist vacancies. So this is very huge. Please be serious. For but for Telangana people only 2 months is the time. Yes, definitely 2 months is enough. Please be dedicated to these 2 months for your preparation only, and definitely you will get. But competition is very very high, so please go to the coaching. So the coaching is very reasonable, around less than 4,000 fees, including classes, test, recording lectures and materials also. For more details you can contact me on given number like 799 531 8103. So that is the contact number. You can contact me. So myself Ashok Kumar. I am from the Andhra Pradesh region, and this is my contact number. You can contact me for GPAT, NIPER, DA as well as pharmacist coaching. I am the coordinator of GDC English classes. Thank you. Subscribe to GDC English classes.